Well, good afternoon. We're at a tipping point in Ontario. We heard from Dr. Brown and Dr. Mohammed yesterday that if the current trends continue, hospitals would be overwhelmed. More and more surgeries will be delayed, and more long-term care homes will be at risk. The situation risks are getting out of control. We need the runway, we need time to get the vaccine to a critical mass of the population. And in the meantime, we can't let our hospitals be overrun by COVID-19. That's why we're taking decisive action to contain this deadly virus as we wait for the vaccine to roll out. And as your government, we will always have your back during this difficult time. We will be there to support you through this. For our impacted businesses, that means unprecedented grants of up to $20,000. These are grants, not loans, up to $20,000 that will help thousands of businesses weather this terrible storm. And today, I'm here to announce new relief measures to support people with energy costs at home during this shutdown. Our government is introducing a new discounted off-peak rate of 8.5 cents per kilowatt hour for both time of use and tiered customers. This rate is actually lower than the temporary discounted rate we introduced back in March during the first wave. Because after months of this pandemic, we know people need that extra help, especially during winter. Once again, this reduction will benefit households, small businesses, and farms. And customers won't have to fill out an application to receive this rate. It's just going to show up on your next bill. And for the parents out there, more help is on the way for you as well. Yesterday, out of an abundance of caution, we announced that elementary students will learn remotely until January 11th, and that many high school students will learn remotely until January 25th. To support parents during this time, I have directed our Education Minister, Stephen Lecce, to expand the support for Learners Program. Parents of secondary school students will now be eligible for one-time payments of $200 per child. This is money they can use to purchase laptops, workbooks, or any other learning supplies they might need at home. My friends, we will do whatever we can to support you. We will spare no expense, but we need your help as well. Don't go to parties or social gatherings. Don't gather with people outside your immediate household, especially during the holidays. Wear a mask when going out for essential trips. It's these little things that make a big difference. I'm counting on all of us to come together, and we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Good afternoon. Throughout this pandemic, our focus has been keeping our schools safe for our kids and providing financial relief to working parents. The medical community has been clear. Safe and open schools are critical for our children, and we firmly agree. That is why, following the holidays, we're taking preventative and proactive action by pivoting to virtual learning at the front end of the school year to ensure we take no chances when it comes to your safety and the safety of your kids, and to ensure your kids can carry on in-class learning for the remainder of this school year. We know that parents will continue to need support through this pandemic, as the Premier noted. And just a few weeks ago, you'll recall the Premier and I were together launching the Support for Learners program, a program that puts money directly into parents' pockets. We're building upon that by extending the program to include, for the first time, parents and guardians of high school children, with the aim of helping even more Ontario families during these challenging times. Under the expanded Support for Learners, our government will now provide $200 of financial assistance for the families of each child aged 13 to grade 12. From January 11th to February 8th, secondary school students and their parents will be able to apply online at ontario.ca/support for learners. For parents with children up to 12 years old or up to 21 with special education needs, the Support for Learners is already open for your applications. Signing up online is efficient, it's secure. The monies should be deposited directly into your accounts within roughly 2 weeks following verification. This support will be part of over $900 million in direct financial support that our government has provided to working families since the start of this pandemic. And I want to thank our students and their families, as well as our education staff, for working so hard this year. You truly have embraced the best of our country as you respond to this unprecedented challenge, and we are all grateful. And to honor that sacrifice, we're asking our young people to do their part, to stay home, to help protect the lives of those they love, their parents and grandparents, and our local communities, and to ensure without a doubt that they can get back into class. And for those students that may face hardship over this time, including especially mental health challenges, know that we are there for you with improved supports when you need them. We will reopen our schools, we will continue quality learning, we will support Ontario parents, and we will get through this. I'd now like to pass it over to my colleague, Minister Walker.
Thank you, Minister Lecce. On behalf of the Premier, Minister Rickford, and all of Cabinet, I'm pleased to provide this update. These necessary COVID-19 restrictions mean working and learning from home for the next few weeks. As the Premier said, we know that staying home means using more electricity, and that at a time like this, the last thing people need is to worry about their electricity bills. And so, starting January 1st, for a period of 28 days, electricity consumption for all residential, small business, and farm customers will be billed at the lowest price, the off-peak rate of 8.5 cents per kilowatt hour. This rate will apply 24 hours a day for the full 28 days. The off-peak price will apply whether you are a time-of-use customer or a tiered rate customer. Ratepayers don't need to do a single thing. This reduction will happen automatically on January 1st, and you will see the change on the next bill you receive after that date. We're doing this to help minimize financial burden and to support you while we're asking you to stay at home. I also want to speak about changes we've requested the Ontario Energy Board implement to the COVID-19 Energy Assistance Program, or what we call SEAP, so that it's available to more families, businesses, and registered charities. We are simplifying who qualifies for the program. If you're behind on your electricity or natural gas bill, then you will be eligible to start applying in January. A residential customer who is behind on their bill can receive up to $750 per fuel type, natural gas or electricity. For small businesses, that figure is up to $1,500 each. I want to thank our partners, the local energy utilities, the Ontario Energy Board, and the independent electricity system operator for coming together so quickly to make this happen. Together, we're providing households, farms, and small businesses with certainty when they need it most. And finally, thank you. Thank you to everyone who is doing their part to help stop the spread of COVID-19, preserve our health system, and save lives. Thank you.
We'll go to the phone line for questions. First question, please.
Actually, if I just take a minute, and before I take questions, I'd like to take a moment to address the situation at our borders. You know, my friends, this is absolutely critical right now. We have over 60,000 international passengers coming into Pearson Airport every week with minimal checks in place right now. And as we all know, with this deadly new strain of COVID-19 spreading around the world at an alarming rate, we just can't take unnecessary risks. And we're all doing our part here in Ontario. People here are shouldering a terrible, terrible burden, along with businesses too. So we're doing what we have to inside Ontario, but there's just not enough to protect us from the threats coming in from outside at our borders on a daily basis. So without further action by the federal government at our borders, we remain at extreme risk right now. And that's why our government has been calling on the feds for months for testing at airports, for further tightening of the borders. And this is bare minimum we can expect. And despite, you know, our repeated calls, we hear every week about dozens of flights coming in unchecked and bringing in COVID with them. And it's unacceptable. And I'm fully prepared, and I always have been, because let me be very clear, the federal government's been a phenomenal partner, been very collaborative the whole time, and we're just asking the federal government on this. We need to work together to secure the borders of our country from this new deadly strain. It's as simple as that, and I know that they also take this seriously. I know they do. I know the Prime Minister takes this seriously. I know the Deputy Prime Minister takes this seriously. So, you know, I just want to work with them. And my friends, this new strain of COVID, it's a massive threat that we just can't take lightly. And we need to do everything possible to prevent it from getting into Canada. And we're prepared to do whatever we can right here in Ontario to help the federal government shore up our borders. We're partners. We can work together. And I've directed our officials to begin preparing infrastructure necessary for testing at our airports. And I hope we won't have to go it alone, but we're prepared to do that if we must. So we just can't wait any longer. And today I'm also calling on the federal government to immediately implement a requirement for pre-departure tests for anyone seeking entry into our country. So folks, this is basic screening measures that can help protect Canadians, and a requirement of a departure test is something that countless other countries have required for months. And I can say, as Canadians, if we want to travel abroad, many countries won't let us in without a pre-departure test, and it makes sense. But we're letting tens of thousands of people into our country every week without the basic screening requirements. And there's no reason why we should not expect the basic level of screening here in Canada. And I stand by, ready to work with the federal government on this, and I just want to get this done. That's all I want to do. I want to work collaboratively. This is a no-brainer. And by the way, the pre-screening or the pre-test before people come into our country, it puts no burden on us, none whatsoever. It doesn't cost us anything. But when people fly in, we want to make sure you get tested. And for any reason you aren't getting tested, we should have mandatory testing. It's as simple as that, folks. We need to work together, all of us, but I'm ready to take questions now.
Over to the operator for the first question.
First question comes from Ashley Legasic at News Talk 1010. Please go ahead.
Hi, Ashley.
Hi there. Thank you, Premier, for taking my question.
Thank you.
We saw how effective asymptomatic testing was for identifying problems for schools. Why haven't we deployed asymptomatic testing to hotspot neighborhoods? Test everyone, ensure isolation and resources for those who test positive for entire neighborhoods, ensure their job security. Wouldn't a provincial-wide lockdown be the perfect time to do something like this?
I'll send it over to the Minister of Health. Thank you.
Well, thank you for the question. You're absolutely right. We have identified 15 priority neighborhoods within the hotspot zones, in the gray zones, where we know that there's a number of factors there that are preventing people from being tested. Sometimes there are language barriers or other barriers. So what we have done is open up our assessment centers for people without appointments for certain hours, because it's difficult for some people to book appointments online or even by phone. We are also doing some pop-up testing, mobile testing in other areas. We're also working at setting up voluntary places where people can go and self-isolate, because in some families there are a number of family members living in fairly small quarters, and we want to make sure that if people do show signs of COVID, that there is a place where they can go and recover and not infect other family members. And there's other wraparound supports that we want to help protect these neighborhoods, ensure that people become well. But we know it's not just about testing. There's many other factors that are involved in that, and we're actively working on those 15 neighborhoods right now. But there will probably be others, and as we identify them, we will bring the supports to them as well.
Follow-up?
Thank you. And Premier, this next question is for you, perhaps Dr. Yaffe as well.
Sure.
I'm just following up from yesterday's lockdown announcement. What are your modeling experts telling you on, I guess, the lag time? How many more people will become infected and die as a result of delaying the lockdown until Boxing Day?
Well, let me talk about this. You know, all the areas, the vast majority of all the cases that we see are within 5 regions. We have Windsor, that is in gray. We have Peel, we have York, we have Toronto, we have Hamilton, the vast majority. And all we're doing is giving the people that have never locked down in their lives. And I remember the media asking me last time we did this, is why aren't you giving them more time? Why aren't you giving them more time? Well, we gave them an extra day or so just to get their life in order, get businesses in order, and just give them an opportunity. But it's the people, it's going to be a big change for them. And we got to help the people. So, you know, we thought we'd give it another day or so, let them get ready. But keep in mind, the vast majority of the population of Ontario right now is locked down. So, and starting as of yesterday, when I said it, it doesn't matter if you're in green, yellow, orange, red, gray. I'm asking you, please don't leave your home unless it's necessary. Every time, as Dr. Mohammed said, every time you leave, you're putting people at risk. You know, so during the holidays, hunker down. But I want to mention something. I'm getting endless calls from people's secondary homes as well. That's fine. Hunker down up there. Take your supplies from where you live. Go there. Do not, I repeat, do not go into town. If you want to stay in an isolated area at your secondary home and you aren't going to leave it, the rules apply up there, that's fine. We just don't want people going to stores every 2 hours, everywhere. Just do your best to hunker down. So that's all we're asking. It's simple as that.
Next question.
Next question comes from Chris Rushowy at the Toronto Star. Please go ahead.
Hi, Chris.
Thank you. Thanks. My questions are actually for Minister Lecce.
Yep.
I'm just wondering, with schools being shut down and kids moving to online learning until January 11th or the 25th, I'm just wondering, are these firm return dates? Is there any reason under which they could be extended, and what would the criteria be?
Yeah, our commitment, Chris, is quite clear. We want to get kids back to class. We have been firmly on the side of parents who believe, as do medical experts and public health leaders, as well as the Chief Medical Officer of Health of this province, that there is a clear benefit for children to be in class. We are asking for we're taking a one-time proactive preventative intervention at the front end of the school year, following the holidays, following New Year's Eve and Christmas and all that, to protect the incredible progress we've made in our schools. So of course our intention is to get kids back into class on the dates prescribed, the 11th of January for elementary students and the 25th for the vast majority of secondary students. We're going to go to virtual learning. They're going to continue to have access to their educator, to mental health supports. We're going to continue to keep them engaged in the curriculum in a positive way. But look, we may not be the problem when it comes to community transmission, but we certainly could play a part of the solution and do our very best to reduce the risks and save lives. And that's what we're going to do in Ontario.
Follow up.
Thank you. So when students do return to school, will anything be different? Will there be any enhanced safety protocols or any resources or any supports for kids, any more supports so that they don't fall behind academically?
Yeah, absolutely. We actually intend in early January announcing an additional $380 million of funds to support improved air ventilation, more staffing, PPE for our schools, additional monies really to further improve the safety of schools, building on our $1.3 billion nationally leading investment. There is no province in this country that has as comprehensive of a plan and as strongly invested plan as Ontario does. In addition to the monies, we've obviously suggested before the first phase of asymptomatic testing was completed, and we intend to expand and build upon that to make sure that we can further improve the safety of schools. So there's a variety of actions. The first day back, there's a refresher COVID training program for students to make sure that they understand how to wear a mask properly, just to really encourage the behavior we want within our citizens and our young leaders. So that's part of our announcements coming out in January. But yes, absolutely, we will continue to step up our investment, our health and safety protocol to keep kids and staff safe.
Next question.
Next question comes from Shalima Maharaj at Global News. Please go ahead.
Hi, how you doing?
Hi there. My question is about one of the areas that we didn't see addressed, and that was people who are working in factories, industrial jobs, being able to get supports established for them. There wasn't really very much that addressed any of those concerns, and certainly we've heard worry that a lot of cases and transmission is happening in these types of environments. So what more can you say at this point in terms of being able to actually make some changes there so that people are safe, they can take the time to go and get tested if they need to, or even be able to recover at home?
Yeah, so people can take 2 weeks off. What we've done with the federal government, again, Got to give them a shout out. We may differ on the border, but we work collaboratively with 99% of everything else. So if you stay at home and you're under the weather, you have COVID, you're getting paid for 2 weeks. That's absolutely critical. Our announcement today on energy costs takes the burden off a lot of people that they're going to be home and energy costs are going to go up. Well, we're going to reduce energy costs. We're doing a wide variety of different items just to help people get through this, and we will get through it. And I can tell you, it pains me, and I'm up every single night thinking these small business owners, and folks, trust me, I hate closing businesses down. I'm not in the business to close businesses down. I'm in the business to save lives and listen to our health experts. As much as I'd love to keep everyone open, health trumps that. Health will trump it every time with me. I am not ever going to ignore our docs. I'm just not going to do it. And but we're going to get through this. The small businesses, we're throwing every support possible at them, upwards to close to $2 billion, just the province alone, not mentioning the federal government. So we just got to hang in there just a little bit longer for another month or so. There is light at the end of the tunnel. We see the vaccines coming in. We wish we could get a lot more, a lot quicker, but we aren't far away from getting people vaccinated, months. So let's just hang in there. And believe me, I hate closing businesses down. Absolutely despise it. But health always trumps that, always.
Follow up?
But we're also talking about employers that aren't necessarily always understanding of the circumstances, that their employees may need that time. So is there actually any sort of concrete measure that is going to be taken to ensure that there are adequate protections for those people should they become ill, certainly considering some do live in generational housing as well, in settings, apartment buildings where, cases of transmission may be higher?
Yeah. So a very, very good question. We've legislated that no one can be fired. If they're off sick or they have COVID, companies cannot fire them. We've also, we're spending over $42 million to put people up in hotels for any reason you catch COVID, and I understand you're in a maybe an apartment, a condo, or maybe a home with multi-generational, kids and family members in there. We encourage you, go to a hotel. We'll pay for the cost of the hotel, because our goal is to make sure we protect your families and protect you. So that's another area that we're going to be supporting people. So folks, for any reason, if you have COVID, please look into getting one of our, call it the COVID hotels, but look into it, because it's going to protect your families and loved ones.
Next question.
Next question comes from Randy Rath at CHTV. Please go ahead.
Hey Randy, how you doing?
Hi, Premier. We're talking to a single mom today who has 2 kids with muscular dystrophy, and one of them has autism. She says that online learning simply doesn't work for her special needs kids, particularly the one with autism. And we're hearing this from parents of autistic kids right across the province. I suppose Minister Lecce is best to answer this,
Yeah.
but what do you have to say to those people that say their kids are really hurt by this?
I'll pass it over to Minister Lecce.
Randy, I think what we'd say is we hear them, and we've acted on their advice before the school year started to ensure that when we have to make these types of decisions to send kids home for an extended online learning experience, that school boards were directed by me to ensure for those kids, the most vulnerable kids, special education, children from the special education community that need to be in schools, that they will be allowed to get back into school during the period of closure. There's exceptions made for the most vulnerable kids within our society, particularly from the developmental disability community. So obviously, we understand how difficult it is for those working parents, for single parents, for all parents in the province. That is precisely why we provided an exception where school boards have been directed by our government to provide in-school supports during that closure period to avoid the circumstance that you suggested where that could place additional pressure on working people who also have to be support their kids during that closure period.
Follow up?
Hey, on another matter, Premier, how long are you willing to wait for the feds to start screening the airport? Do you have a hard date as to when you'll start to screen people coming into the airports?
Well,
And also, you say that it will be devastating if this new strain gets into the province, but if that happens, what will the devastation be? What could the scenario be if we get this new, more active strain?
Before I hand it to the Minister of Health, we still are working with the federal government, but we can't wait and delay it. But every day we delay it, thousands of people are landing. You know, I live right by the airport. I'm watching these planes coming in constantly, and we just have to check people. This is so common sense. I've never seen something so common sense that we're going to get up and running. We're going to do it with them or without them. I prefer doing it with them because, again, they've been a good partner, and we're just going to get in there and get it done. So we're going to move as rapidly as possible. I had a conversation with the GTAA yesterday. They're ready to go. I know the Minister of Health is working hard on this. And as for the other strain, I'm going to hand it over to the Minister of Health. Thank you.
Well, we haven't seen this mutated strain in Ontario as yet. We don't know that much about it, but what we do know is it's 70% more transmissible than the existing COVID rate. So what we would see would be many more cases of COVID-19. We'd see many more people with very ill health being hospitalized, putting a greater risk to our hospital capacity. But from the scientific and medical perspective, I'd like to ask Dr. Yaffe to please come and speak to that issue.
Thank you. First, I think people should realize that COVID-19 is a virus. It's not unusual for viruses to change and mutate. As they multiply, sometimes they make an error in the multiplication process, and that, 99% of the time has no impact at all. This particular mutation that's happened in the UK was actually first identified back in the fall, I believe in September, but in the last month, we've seen a rapid increase in cases in southeast England, particularly London. And the vast majority of the cases are that mutation. So it has multiple mutations or changes, but the most important ones are on the spike protein. So everybody's seen pictures of the coronavirus, the COVID-19 virus. It has these spikes on it. And so those are proteins, and that's how the virus latches on to the human cells and enters. So there's been a significant mutation in the spike protein that is making it more efficient for the virus to get into the human cells. So that's the theory of why we believe that it's more transmissible. It's more easily spread between people. At this point, there's no evidence to say that the illness it causes is any more severe or any different. And there's no evidence that our vaccines would be any less effective, as in our vaccines would work against this mutation as well. And the good news is we don't have any evidence of this mutant strain in Ontario at this point. The lab is obviously doing very careful surveillance and what we call genotyping of all the viruses that are identified, all the COVID-19 viruses, and has not identified this particular strain. Obviously, it's preferable we don't get the strain in Ontario because it is more transmissible, and as Minister Elliott said, would result most likely in more cases. And so, it's a good thing that we're going into this shutdown so that it can help reduce any transmission of the virus, and if the mutant virus enters, of the mutant virus as well.
Last question.
Last question comes from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Premier.
Hi, Graham.
I wanted to give you the chance to respond to Dr. Etches and Mr. Watson, Mayor Watson, yesterday. I understand there was some strong language coming from your office about what they had to say. Did you want to say anything about their response to the lockdown announcement yesterday?
You know, I have a great deal of respect, I have to tell you, for Mayor Watson and Dr. Etches, and I've said right from the beginning, Mayor Watson's been a tremendous partner, and his support has been absolutely critical throughout this whole pandemic. But of course, you know, we're going to continue to monitor the shutdown measures, and I'd love nothing more than to ease them. Make no mistake about it, folks. I'm talking directly to the people of Ottawa. You know, I just have to remind everyone in Ottawa, you're in the orange restrict level. You aren't in yellow, you aren't in green. And just imagine if I said, okay, let's open up Ottawa and forget everyone else, twofold. People are going to flock to Ottawa by the way they are, because I've talked to someone in the business of the hotels, and they said their hotel's packed. And then Gatineau would be flooding over here. And I remember, they're saying, no, it's not Quebec. Well, I remember distinctly Mayor Watson asking me to call Premier Legault in the first wave and ask him to talk to the mayor of Gatineau to make sure people aren't coming over the border. So it's even worse now. All I'm trying to do, I don't want to play politics. I'm here to save lives. And again, I respect Mayor Watson, but we just can't take any unnecessary risks right now. And no matter if it's 2 weeks or 28 days or whatever it is, folks, it's not the end of the world. We have to protect the people of Ottawa. And I've never seen one politician in the entire world, one politician, when they let their guard down and they open up the economy, not one single person has been able to defeat this virus. And this is a deadly new strain of COVID, and it's spreading rapidly around the world. We all see it. Now, I can tell you, now is not the time to ignore the advice of our health experts, and I never would. I don't put businesses ahead of health. They go hand in hand. If you have a healthy population, you're going to have healthy businesses. And by the way, I was just briefed about a new report out of Ottawa. And this is what I'm talking about, folks, in Ottawa. So the new report on levels of the COVID-19 found in the sewage are spiking up. And then I hear that long-term care. So two indicators, and this is an early indicator, and it's a warning sign that we can't take anything lightly. So as soon as we think we're out of it, it comes back with vengeance. We've seen it. But now is not the time to ignore the experts. And another sign is in long-term care. There's cases going in long-term care. In every region in Ontario, when we start seeing it seep into long-term care, it means it's within the community. When we see the sewage and the numbers are spiking, you know it's coming. And I'm praying it doesn't come. And I mentioned that to Mayor Watson through a message. I just pray to God, we don't see COVID spike and the numbers spike up. So I'll continue to listen always to the health experts and the scientific evidence. And I'll continue to do whatever it takes to take care of the people of Ottawa. I always have. We have great MPPs, we have great ministers. I think it's a great community, and you've done a phenomenal job. But to get in an argument back and forth over, honestly, in my opinion, I think there's a little bit of politics going on. I don't care about politics. I'm here to protect people's lives. Folks, in the businesses out there, as I told you earlier, it kills me to close any business. But I'll tell you one thing, I'm going to protect you. I'm going to have your backs. And when we come out of this, we're going to be booming. We will lead North America once again in job creation, economic development with everyone's support. So, folks, I want to thank you. And let's keep plugging away. Let's stick together. We are going to get through this. We're doing better than a vast majority of the rest of the world, all because of each and every one of you, and all because of the 444 mayors. You're doing a great job. So thank you, and God bless everyone. Thank you.
There's